Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
I'm Dr. Redwing.
I'm Nicole Callan, Dr. Nicole Callan.
Thank you so much for joining us again, Dr. Callan. We love having you on this show because you're so smart and you give us so much cool information. And today we're talking about
Hernias.
All right, that's
So
a big
common.
topic.
Hernias.
Big topic. We're going to break
Love
it down.
hernias.
We won't cover the whole thing in
Oh,
this
it's
one
huge.
video,
Yeah.
but we'll zero in on a few important
Yeah.
aspects.
Let's start. What's a hernia?
So it's sort of something that keeps me up at night for emergency surgery, which is why it's probably a good idea to fix it electively.
Okay, so it can be an emergency thing that takes you to the emergency room and gets you to see a surgeon right away.
Yeah. Yeah, right away.
Okay.
You have to be aware of it though.
Okay, hernia. So it is really anatomically.
So it's like a weakness in your abdominal wall. So we have 7 layers to the abdominal wall.
Okay.
But if you get a breach in those layers, so all your 7 layers of your abdominal wall are keeping all your intestines and all the insides of your abdomen inside, right?
Okay.
But if you get a hole or a weakness, then things can protrude out through that hole.
Almost like when you're blowing up a balloon and then one part of the balloon all of a sudden goes shooting out like that?
Yeah, pretty much.
Okay, so the thing that worries us when this starts protruding is your intestines.
Yeah.
Okay. So that's a hernia. Basically, you can have a hernia. You can have a herniated muscle. You can have a herniated, piece of tissue anywhere in your body. But the hernias, in general, that we're talking about is when some intestine comes and herniates through the abdominal wall.
Yeah.
Okay.
And there's a whole bunch of different types, but today we're really talking about the inguinal hernia, which is the most common type of hernia.
Yeah, and if I just kind of briefly discuss the common types, the most common ones are going to be your umbilical hernias, often a weakness from pregnancy, from just being born.
Yep.
So you can get, if you've had any prior surgery, you can get what we call incisional hernia. So that's where you've had a prior surgery. We've closed that up, but somehow it doesn't heal properly, so you get a hernia through there. And then obviously the most common ones are, and there's other kinds as well, but the inguinal hernias.
Okay.
Okay, so umbilical, incisional, inguinal.
Yeah.
And we're going to focus on inguinal.
Yes.
So what's the big deal? A bit of bowel sticking out through some muscle.
If your bowel, let's say you lift something heavy or you cough with so much pressure so I got a little hole, all my bowels pop out through there, and then too much came out through the hole, now it won't go back in.
Okay.
So the first thing you're going to notice is probably pain, unless you're elderly.
Okay.
Elderly people sometimes will get these hernias stuck and they won't even know.
So when someone shows up in your office, is that the story? They're like, hey, I was lifting something, now I have pain in the groin, or how would they present?
Often, most
Okay.
commonly, so they will have been lifting something, gardening, and then they felt a lump. Initially starts with a pain, and then they get a lump that kind of comes out, and they lay down and they push it back in.
Okay.
And then
So
it
you
goes
can
back in.
physically see it.
They can see it, yeah.
Okay.
Okay, so when it goes out and comes back in, it can be managed sort of on an elective basis.
Yes.
Then you mentioned when a part goes out, it can't get back in. It's strangulated, is
Yeah.
that the term we use?
Yeah.
Strangulated hernia, and that's when it becomes an emergency.
Yeah, so we'll say it's incarcerated.
Incarcerated.
Because it's stuck.
Okay.
Strangulated means it has no blood supply.
dying.
Okay.
And potentially bowel is dying.
Okay,
so.
okay. So we'll stay optimistic, call it incarcerated.
We
So-
want to be acting on those quickly though.
Okay.
Incarcerated is
Okay.
to be treated.
So that's your threshold. It goes and it
to
comes
be
and goes away, managed electively. Happens, doesn't go away, incarcerated, hopefully not becoming strangulated. That needs to be treated urgently.
Yeah.
So first of all, so you have those symptoms and you go to your doctor. What do you do? Like what kind of tests do you do in the office? How do you diagnose a hernia?
So physical exam is key here.
Okay.
Oftentimes I'll see people in the office with groin pain with an ultrasound that says a hernia. But if you look at the inguinal canal, like the anatomy of that inguinal canal, it's very complex. Like
Yes.
it takes years to kind of really understand the anatomy of this. So an ultrasound is not what I'm going to act on. I'm going to act on the presence of the bulge coming out that goes back in.
Okay.
Okay.
So I don't need an ultrasound.
So would you stand them up and do a physical exam typically in a standing position?
Yeah, my favorite actually is to lay people down and make them do sit-ups.
Okay.
Yeah,
Okay.
because it'll come out with the sit-up.
Plus
Wow.
you get a six pack.
But often, yeah, right?
See,
May aggravate the hernia.
This is an important thing current nowadays because physical exam is so important. And
So important.
Telemedicine is a very common thing now where we're doing a lot of medicine over the phone, and it's hard, or visually, through a video link.
You're like-
You won't feel that.
No, I know. And what are you going to say? You got to move the camera lower. lower, lower. It's not going to
Getting
work.
weird.
So for those, you got to get to see a healthcare
Yeah.
professional to have it
Because
examined.
for me, I can feel when I pop that hernia back in and I say, oh, this is surgical. Like this for
Okay.
sure needs surgery. If I can't feel it, I'm hesitant to repair anything I can't feel.
Okay.
So we've made the diagnosis, and now I guess we talk about it. So is there any way to treat this non-operatively?
So in elderly, frail people who aren't candidates for surgery, we'll give them hernia belts.
Okay.
So you can go to Shoppers Drug Mart. They can.
But it can't heal per se.
It will not heal.
Right,
It will
okay.
never heal without
Important
surgery.
distinction.
Yeah.
Okay. So hernia belt or some type of buttress to hold that
Yeah.
stuff coming in out,
Yeah.
put it back in.
Yeah.
Okay. So then we get to the surgical side. How do you decide, or how does the patient decide, hey, I need to do something about this?
So usually the decision is based on symptoms. Most people you're seeing have symptoms, and that bulge is either growing or changing. So if it doesn't bother them and they're a reliable patient, you can say, well, monitor it, and when you're ready for surgery, let me know.
Okay.
Generally, it's probably going to get bigger. It's probably going to become more bothersome. So it's probably worth fixing while it's smaller.
Okay.
The bigger it gets, the bigger the repair required. Right?
Now, how do I know I have to go to the emergency room for this? What are sort of those signs
point.
and symptoms that are like, okay, this is not an elective scenario, this is,
So the most obvious is if you're going to get the bulge with pain.
okay.
So there's either fat or your intestine, your bowel that is stuck in there. You need to be assessed.
Okay.
And if you can feel the lump, the first thing you do when you go to emerge is say, I feel a lump here. So
Okay.
make sure someone examines your lump.
Okay.
Now, as I said, some elderly people don't. It's interesting. I think as we age, we lose our sensation. Our nerves don't fire as
I
well.
think older generations were tougher too.
Or perhaps they're very stoic.
I think they were.
But they'll show up more with a bowel obstruction.
Okay. Oh, okay.
Where they're having vomiting, they
Right.
haven't passed gas in 2 days, and you find that this tiny little lump in the groin that is
Okay.
a hernia with a piece of bowel stuck in
This
it.
is interesting. So an unusual presentation compared to non-elderly people.
Yeah, or
Okay.
no, that would be for elderly.
That's elderly,
Yeah.
but yeah, compared to non-elderly, that's
correct,
unusual.
yeah.
Okay. All right. So there.
And then I was going to say the surgical treatment would be A, to push it back in and then close the hole, or
Yeah, so depending on how long it's been stuck.
Sure.
Because if, let's say, it's been stuck for like 5 days and you're concerned about it being dead, you don't want to push that back in because then
Right.
you're potentially pushing back in a piece of dead bowel that's going
Right.
to leak everywhere in your abdomen. So that's not a good idea.
So best case is you repair the hole. Worst case is you could remove you might have to have some of your bowel removed theoretically.
Correct.
if
So
you're
that's
really sick.
usually what we're having to do late at night because that's sort of a priority. Well, it is a priority. It's not sort of
Yeah,
a,
it's an emergency.
Yeah, it's an emergency.
Okay.
Wow. Okay. So there you got it. Your history. You're going to have a bump that you feel, and it can come and go. That's sort of an elective sort of approach you can take to that, or a bump that comes that's painful, that's not going away. You might have to get that seen urgently.
Yep.
A physical examination will be done by a healthcare professional who can palpate or feel the lump, feel if it reduces, feel if it doesn't reduce,
Yep.
feel if it goes away or doesn't go away. And then we talked about treatment options, conservative, where we use a mechanical support, some
Yep.
kind of belt or something to hold it in. And if that's not working, you might need to go to a surgical
Yeah.
intervention, which is actually push the bowel back in or the fat back in and repair.
Well, actually, no. So the surgery will be. So there's different approaches, right?
Okay.
So there's a laparoscopic approach where
Okay.
you can go in with laparoscopy,
Okay.
reduce that bowel, so kind of use your graspers and pull the bowel back in, assess it, see if it's viable. If it's not, you'll have to do a bowel resection. And then you have to repair the hernia as well.
Right.
So that can also be repaired laparoscopically. If
Okay.
there's no contamination, you can
Right.
put a little piece of mesh in there.
Ooh,
Right.
that's cool.
Then there's the other repair, which is the sort of the classic repair, which would be the open repair, where you go directly over top of the hernia, get through those layers, find the hernia, assess the bowel, see if it's viable. If it's not viable, you can often resect it through that same incision. Sometimes you have to do a bigger incision.
Okay.
And then your repair with that is can depend on contamination or not. So if it's a contaminated field, you cannot put a piece of mesh.
Okay.
Electively, when you're not contaminated, you can put a piece of mesh to help it come back from coming back, right? To prevent it from coming back.
Wow.
That's a lot.
Okay, so that's our
It's
introduction
good.
to hernia video.
Yes.
We'll definitely have to make more of these because people are going to ask some questions
Oh,
about
yeah.
different
Specifically
types of
about the surgery and about the mesh. There's lots of stuff
which is
about mesh and
probably
stuff.
all of them are long discussions
Yeah,
on their
for
own.
sure.
So
All right.
If you like this introduction, please like it. Subscribe to our channel.
And remember, you are in charge of your own health.
And thanks again to Dr. Callan for joining us.
Thank you.
We'll see you next time.